Well, the Prime Minister has been defending England's border controls after it emerged that officials have been unable to find one of 6 people infected with a variant of coronavirus first found in Brazil. Our political editor, Laura Kuenssberg, has more.
An unwelcome arrival. A new variant of coronavirus has landed on UK soil. With 2 cases near Bristol and 3 in Aberdeen, extra tests are being used to track any spread. But the urgent hunt is for a 6th person with a positive test who can't be found.
Look at what we've done in the case of the South African variant. A massive effort went in there, and the same is going on now to contain any spread of the Brazilian variant.
It's caused concern, not just because there was chaos in Manaus in Brazil where it was first found, but the risk is that it spreads more easily and responds less well to the vaccine too. The mystery patient carrying the variant hasn't been traced because they didn't fill in their paperwork properly. The variant was detected on the other side of the world, in Japan, in early January. On the 15th, the government banned travel to the UK from Brazil and other South American countries, but British nationals were still allowed to fly back as long as they isolated at home for 10 days. After weeks of discussions, the government then changed the policy, deciding on the 27th that Brits coming home from countries at risk would be quarantined in hotels as soon as they arrived. But it wasn't until 3 weeks later, on the 15th of February, that passengers started having to stay in hotels rather than travel home, after the 6 had developed the disease.
Government measures at the border have been too little, too late. They've been behind the curve. The government was warned about putting the hotel quarantining system into place as soon as possible.
Someone carrying the Brazilian variant was able to disappear weeks after the variant was first detected because the government hadn't yet got round to introducing quarantine hotels. Do you believe that that delay will have put people at risk?
No. We had already quarantine in place. And in fact, we'd already put in place a ban on direct travel from Brazil. Also, this positive test was on the 12th or 13th of February, we think. And that was obviously over 2 weeks ago. And we haven't seen any further knock-on transmissions in the data.
This is more than just a political "I told you so" moment for the opposition. It's a reminder of the threat from new forms of the virus that will continue to emerge. And the government isn't willing to cut off the country from the rest of the world completely. So it is a risk that won't be straightforward to manage. Last night, London's Heathrow looked as if they were struggling even to manage social distancing in long queues. As the search for the patient with the variant continues, the dilemma is stopping the disease coming in without stopping everything taking off. Laura Kuenssberg, BBC News, Westminster.
The latest official figures show there were 5,455 new coronavirus infections recorded in the latest 24-hour period. That's the lowest since September. It means an average of 7,980 new cases were recorded per day in the last week. Across the UK, 14,808 people are in hospital with coronavirus. In the last 24 hours, 104 deaths have been recorded. That's people who died within 28 days of a positive COVID test. On average, 314 deaths were announced every day in the past week, the lowest it's been since the beginning of November. The total number of people who have now died is 122,953. Almost 186,000 more people have had their first dose of a vaccine in the latest 24-hour period. So just over 20 million people have now had their first jab. That's more than 38% of the UK's adult population. Well, our medical editor, Fergus Walsh, is with me now. So millions and millions of people have now been vaccinated and the results are looking very promising.
They are, Sophie. The evidence on vaccines today is quite simply stunning. They are way more effective than scientists would have dreamt of a year ago. And what we can say pretty categorically tonight is whether you have the Pfizer jab or the Oxford AstraZeneca vaccine, they both work really well, offering strong protection against serious illness. Now, that's among the elderly, those most at risk, who we'd normally expect to respond less well to vaccines. You'll remember that several European countries decided to restrict their use and not give them to older adults. Well, some breaking news tonight. The French health minister has partially reversed its country's decision, and now the Oxford AstraZeneca jab will be available to people aged 65 to 74 in France. Now, this spectacular effectiveness here just comes after one dose. It will be absolutely essential people have their second shot. That should boost effectiveness beyond 90% and make immunity last even longer. But it's not 100% effective. And while there's still a lot of virus circulating, it's essential that people keep their guard up and maintain social distancing. And then there are these new variants. They are a potential worry, but clinical trials of updated vaccines which will deal with these variants are planned for early summer, and they should be ready, those new updated vaccines, by the autumn, should we need them.
Fergus Walsh, thank you.